Hi, I'm Carolyn, trichologist at Absolique, and today I'd like to talk about hair loss treatment for menopause. So, as a trichologist, I'm a hair and scalp specialist, but what I'm seeing is this menopausal hair loss treatment confusion is because people are not understanding, or the treatments out there are not defining definitive against the difference between hair loss and hair thinning. So hair thinning can be gradual. It's generally in patterns or patches, but it is not physical hair loss. So with your pattern hair thinning, it's a very gradual miniaturization, and it typically occurs in the recessions and frontal parts of the head. Whereas the difference between diffuse hair thinning is a result of telogen effluvium, and it's affecting the hair at the back of the head as well. So identifying hair loss versus hair thinning, it's really simple. When you're physically seeing more hairs than normal, we all lose hair every day, but when you're seeing more than normal, and it's normally for a continued period of time of about 3 months, that's physical hair loss. That's not generally the menopausal type of hair thinning, but it can be caused, it's called diffuse hair loss, telogen effluvium, medications, nutritional deficiencies, thyroid imbalances, which are also hormonal fluctuations to do with some parts of the endocrine system. Whereas the general hair thinning, as I said, again, it can be in the pattern hair thinning, which gives you a clue, or it can be diffuse. And really only a microscope can show the difference. And it's really important to know what is going on to choose the right hair loss treatment, particularly in and around menopause. So when we've got a diffuse type of thinning, and I'm seeing this in most women that think they've got female pattern hair thinning, it's actually been diffuse, and it's been happening for a long time and I didn't know. And it's affected what we call the overall hair cycle and the hair cell health. Whereas the pattern hair thinning, it only ever is in, as we said, the front hairline recessions and what have you. Rarely do I ever see just the female pattern thinning on its own. And the other thing is, when you sort of go to your doctor and you say, I've got some hair loss or hair thinning, and you're not sure what's going on, they just say, oh, it doesn't matter. It's just age. And I want you to know it is not age. Yes, it happens around menopause, but we've got hereditary factors, hormonal factors, environmental factors, free radical effects. And I'm finding most of these women, when I see them, they've got low iron levels still. They've had lots of stress. They've had surgeries. They've had multiple pregnancies throughout their life, which is postpartum alopecia, hormonal changes, and all these seem to be hidden causes, but they accumulate. Okay, so now we've also got this, hereditary factor of, the female pattern hair thinning, and it's a combination of things. So I find that the combination causes that I see with the microscope is we've got past telogen effluvium, which now is loose anagen syndrome, pattern hair thinning, and diffuse hair thinning. So a treatment must address all of these things, whereas a lot of the treatments that you're seeing online, once you start them, you get hair loss. When you stop them, you get hair loss. They can actually be causing other sorts of side effects as well. Whereas if you start with a proper diagnosis, and someone like myself who's more of a holistic trichologist, and I try and do natural hair loss treatments, we address the underlying causes. So what we get out of that is really good hair growth, but good health, and then you're going to breeze through the rest of menopause into the transition of a happy life, which is the way it should be. So if you want my help, I'm based here in Brisbane. In Spring Hill, I can help you in clinic with my microscope, but we also do a lot of online services if you're happy to get a microscope, and I can advise some specifications of what to get. We get some amazing results, like we transform lives and hair in as little as 4 months. So please just don't go out there and do any old hair loss treatment, and don't accept that hair loss or hair thinning is age. And I'm talking at any age, it's not acceptable. It is actually a choice. If you want to reach out to me, probably email the best or jump on our website that you can see there. All right. Thanks so much for listening.